Hello friends, I am Dr. Sadeep. Welcome all to our channel DEMOMEDICO-DIVINE Master. So today I want to make you understand about this miasm theory. Basically, as a beginner, we will be little not confident or what to say, like worried about these miasms, simply because we are not getting into the things. I mean to say that what is Sora, what is psychosis, what is syphilis. This is a totally new concept in total disease understanding. Due to that reason, so beginning homeopath or a beginning medical graduate will not at all understand the head and toes of this miasm. So this is the thing happening with all the beginners, and I also faced the same problem. So I could not match the miasms with the patients and the drugs. When you match all these three together, then comes the disease understanding, and then comes the curing part of the disease. So today I want to talk about this miasmatic understanding for the beginner homeopathic graduates or medicos. Miasm is nothing but the manifestation in the body, the totality of the manifestation of the tissues, cells and the disease manifestations. I mean to say that how the disease starts in a human being. So all people will not be psoric, all people will not be psychotic, all people will not be syphilitic or any combination of miasms. Every individual person has its own miasmatic tint. So this we can understand by two ways, friends. One is how the organ is affected, what are the symptomatic presentation of that organ, and another very easy technique has been in these recent days has been evolved by one of the Australian homeopathic doctor, facial evaluation of the miasm. This you can search in the Google and you can get that book, friends. So that is very useful in homeopathic miasmatic diagnosis of any patient. You will understand by facial features which miasm is dominating in which person. So this is helpful for the beginners to understand the miasmatic theory. So we in our books we will be focusing on Sora, psychotic and syphilitic miasm mainly. Remaining four miasms are not been taught or not been read by ourselves, so that it will be a lagging in our understanding of the miasms. Until and unless we will get into the total understanding of miasms, there is no possibility of curing. So due to that reason, many beginning homeopaths will fail on whatever the case they will take or whatever they are case dealing with. So if you come to a conclusion of understanding of miasms, then real magic of homeopathy starts. So to understand the miasms, you must basically understand each miasm in detail. So we will take each miasm in detail and make you understand how this miasm starts in the human being, how the cellular level presentation will be there, how the symptomatic presentation will be there, and what are the pathologies formed in each of the miasms. So in the next session we will be dealing with this, friends. Today's session I wanted to make you understand miasms are the necessary things to homeopathic practice. If you don't have any basics of miasm, it is very difficult to take a case, and it is very difficult to treat even the acute diseases, simply because even in acute diseases miasmatic theory is applied. If not, the totality will be reached. The miasmatic totality has not reached. Due to that reason, the medicine will fail or the patient will not be recovering. So I wanted to make you understand about this miasm today, friends. I think you enjoyed this session. You send this video to your friends, colleagues and medical graduates and medicos whom you know. This is all today, friends. Thank you. Take care. Bye.